It's 4 o'clock. Call the Board of Supervisors into session for our 4 o'clock work sessions for ARP. We will start with Clark University and Jamie Ogara. Yes, go up to the podium, please.
Okay. Yes, I'm Jamie Ogara with Clark University, and I'm project lead of the Dubuque Youth and Family Resilience Project.
Welcome. Welcome. Might want to get a little closer to the microphone if you can.
Okay. Do you just want me to tell you on the next slide or?
Go ahead.
Are you running it, Kevin? Maybe you can.
Oh, okay. Oh, I think we missed. Go back. And then the next one. Okay, so what this is it is a online survey that parents take in Dubuque. So anyone who has a child in K through 12 in Dubuque, and our primary research objectives are to understand the direct impact of the COVID-19 pandemic on youth and health well-being, and then also to understand any indirect impact of COVID-19 by examining the roles of parenting and community engagement. We also want to be able to identify youth who are doing well despite experiences of adversity, and then to identify those factors associated with youth resilience. Next, please. Our secondary research objectives are then also to understand what types of adversities families are experiencing in Dubuque, explore the ways in which parents engage with their children in the community of Dubuque, and then identify demographic factors associated with risk and resilience in youth, Dubuque youth. Next, please. So to give you an idea of some of the variables that we are looking at, we ask questions on the survey that target these specific areas. So in addition to trying to understand about COVID-19 and the impacts of COVID-19, we're also asking families about trauma they've experienced, experiences of discrimination, and variables related to their socioeconomic status and class. We're interested in parent-child interactions, so parenting practice, specifically what they do to discipline or engage with their children, quality time spent with children, and then how they're engaging specifically with their children in the community. We're also interested in questions about co-parenting, so how mom and dad co-parent, or how mom co-parents with stepdad, or dad co-parents with stepmom or stepdad, etc. Our outcomes that we're really interested in are youth resilience, and we're operationalizing that as physical health, brain health, anxiety and depression, and academic success and academic readiness. Next, please. So this shows the pathways that we're examining. So you can see the line is going straight from family adversity to youth resilience. We want to understand how COVID-19 and these adversities are directly related to resilience. But what our previous research has shown is that parenting and co-parenting are pivotal in mediating that relationship between adversity and resilience. So we are also looking to see what sort of parent-child interactions and co-parenting interactions may help mitigate adversity or promote resilience and/or promote resilience. Next, please. Our current project has been funded partially by the James B. and Melita A. McDonough Foundation. We are recruiting participants, so up to 2 biological or adoptive parents of youth in Dubuque at grades K through 12. So these can be any children who are residing in Dubuque County. We are including moms and dads. We're trying to get as many 2-parent dyads as possible. This can also be adoptive or biological. This can be same-sex couples. We are trying to be as inclusive as possible. Our goal was to get 100 families, so 200 total participants, and that project is currently funded for 1 year. Why we are interested in the ARPA project funding is so that we can move this from a 1-year project to a 3-year project. Right now, we are going to get great data for the 1 year, kind of a snapshot in time, what's going on with COVID-19 and how is it affecting families. But with the ability to move it from a 1 year to a 3-year or a 2-year project, we can get longitudinal data. And so we can move from correlational understanding to causational understanding of how these things affect youth. We can look at trends and we can look and see how things may change over time. So with the ARPA funding, it will be a nice supplement to the McDonough Foundation funding that we already have. We're going to same participants to up to 2 biological adoptive parents of youth in grades K through 12 that reside in Dubuque County. Our goal is to retain the 100 original families. So we'll be following the same families to be getting consistent data. Plus, we're also going to put in our budget the translator so that we can include non-English speaking families. Right now, our research team only speaks English, which is a limitation. So we are trying to get translators in there so that we could possibly have Marshallese or Spanish speaking families as well, to get a better representation of some of the families facing adversity in Dubuque. So again, the funding that we have applied for would be an additional 2 years. So it would be a total of 3 years with the McDonough funding. Next, please. Here's our timeline. So right now we're in the middle of collecting data, wave 1 data that we've started in late fall, and we're going to be collecting into the summer. Wave 2 would then be the following fall. And then by next spring, summer, we should have results from wave 1. Then the fall of 23 to spring of 24 would be the wave 3 data collection. And then the subsequent spring, summers, we would have the results. So we're looking at being able to look at 3 years of data by 2025, if not earlier, depending on how quickly we can get that data in, collected, analyzed, cleaned and analyzed. Next. Here's our truncated budget for research assistance for the 2 years is about $13,500. Personnel stipends, which includes a statistician, the translators, and then myself as well as the co-project lead ability to work through the summers and to over the school year to do our research would be $35,400. Travel expenses to share our results with community partners as well as also other conferences, about $5,000. Materials around $3,000, and then most importantly, and what the funding is, the bulk of the funding. What we're concerned about mostly is the participant compensation. So it's very important to us that we're able to pay our participants for their time. Ethically, if we're asking participants to share about their information in their own lives for us to do research, they should be compensated for that. And also many of these families are in need. And so taking even 30 minutes out of their day is taking time away from work or from their own families. And so we felt it was of utmost importance to be able to pay these participants. So we're currently paying them at $30 per survey, and that could be up to $60 per family. And then if they stay with us as an incentive to stay with us, so we don't have as much attrition, the follow-up survey at wave 2 would be $40 per survey and then $50 per survey at wave 3. So that's why currently we are actively still recruiting. These are our current community partners. And so we are about halfway through our goal N, but recently we've been able to partner with the VBNA and Hillcrest, and we hope that they're going to be even they're going to be able to help us to ramp up that recruitment even more. So we're very excited about our community partners, and I think it's pretty exciting for us that in a very short time, within a year, we've been able to gather these community partners that are excited about our project and willing to help us recruit families. We also promote through social media, and then we have a web page that describes our study and provides a link for families to sign up for our study. This is just kind of a breakdown of the counties in Dubuque. And so currently we have spent most of our time and efforts with community partners in Dubuque and Asbury. That is the most highly populated areas. However, we would like to be able to spend more time recruiting into more of the rural towns. We do already have some participants from Dyersville, from Potosi, and Cascade. So, but yes, with the limited, time and resources that we've had so far, we've really kind of just focused on Asbury and Dubuque. But we're aware that there's others out there. So importantly, how's the data going to be used? So we want to share findings through written reports and oral presentations. Specifically, we are going to work directly with those community partners that were listed on those last couple of slides to share results and find ways that the results can be meaningful for them. So that depending on what we find, we're hoping to be able to improve existing programs or develop new programs based on the adversities that we're seeing and why and the factors that are promoting resilience in these children who are doing well despite experiencing different adversities. One other thing that we're hoping to do with the data is to be able to possibly even inform city or county initiatives and policies that could help direct costs to bolster youth resilience. One example I give, and we don't know yet because we haven't gotten the results, but we may find that there's a group of children who are doing very well, even though they've experienced discrimination, trauma, serious issues with COVID-19, but their mom and dad seem to be co-parenting really well and dad is really involved. So we may decide that it's worthwhile to initiate a fatherhood program or fatherhood initiative at the county or state level, similar to what they do in cities like Milwaukee and they found some success with that. I just use that example as a fatherhood researcher. So we don't know what we're going to find, but that's one example. And of course, we plan to publish and take this to conference presentations as well. That's all I have.
Go ahead, Jay.
Okay, thank you for being here. Appreciate that. I've got a couple questions. You hit on some of them already, but can you tell me a little bit more about your target market? Maybe not target market, the people that are going to be part of this study. Is it going to be, will you look at representation related to income or race? You mentioned a little bit about, location. Can you expand on that?
So right now it's kind of in its pilot phase. So we're just trying to get as many participants as possible in Dubuque. And so we're not really discriminating against any participants. So we want participants from all socio-demographic backgrounds at this point. We plan to, and I plan to do it this week actually, to see where we're at with our socio-demographics, meaning the race and ethnicity, poverty level, those kinds of things, and then be able to hopefully target participants that are more diverse. So since we're at that halfway mark, that's why we have tried to partner with groups like Hillcrest and the VBNA that might be able to help us get a more diverse group of participants. Did that answer your question?
Helps.
Okay.
And then maybe just one other follow-up question, just the final report you mentioned. Give me some sort of visualization or description of what that would look like. So what would I anticipate if we fund this 2 or 3 years from now? What would I expect to see?
So we're planning to tailor our reports to the needs of each community partner. So that is where that personnel comes in. So Hillcrest may want something different and then the board of the county supervisors or something like that, or the schools may want something different. So we're going to be working with each of our community partners. Maybe they're more interested in parenting data. Maybe someone's more interested in socioeconomic data. So we can tailor those reports to whatever need is of our community partners. So that can look at in a formal report where we just show our data, all of the descriptives. We plan to do some more sophisticated statistical analysis, hierarchical learning or modeling, structural equation modeling that allows us to look at family individual level factors, as well as community level factors. So that would take a little bit more time, but we can have the descriptive statistics pretty readily available as soon as all that data comes in. So it can be a written report. We can come give oral report presentations and yeah. So
thank you. Very interesting concept.
Okay.
Ann, do you have any questions?
Dr. Ogara, thank you for being here. I'm sorry I'm not with you personally today. I'm not really that well. This is a very exciting project. Obviously, the whole city now knows that's something that the McDonough Foundation did support and give you an initial year of funding. To my colleagues, I would just say that we had hoped that this would be one of the projects that the East Central Regional Governing Board would fund, but the data is going to be too specific to Dubuque, and the state funding for brain health projects doesn't allow the region to fund research like this. So I think that, I think, Jamie, maybe you can indicate, since you've begun this project, are you aware of anyone else who's doing work similar to this?
I'm not aware of anyone that is doing a project like this, a community engaged project. No, not to my knowledge.
You mentioned the fatherhood research. Can you just very quickly highlight the level of research that you've done in the past and how that reformulated your idea behind this project?
Sure. So, well, my dissertation research is on economic hardship and the effects that how that affects father involvement, and in turn, youth risk and resilience, so mental health and delinquency. And so that's informed research showing that when fathers have experiencing adversity such as economic hardships or poverty, they are experiencing issues with mom, which then in turns impacts how they are involved with their children. And then that affects how well the children do. They have more mental health problems, and they're less resilient or less able to overcome their own adversities. So I have published several papers on fatherhood initiatives and the importance of fatherhood. And we, to my knowledge, don't have a ton of fatherhood groups yet in this, as far as I know, and I could be wrong, but again, that is just an idea that I have, but of course it'd have to be supported through the data in order to support that. But really what this project is about moving away from a reactionary type process and dealing with family problems and learning at the front end what's going on, so that we can have programs in place that help families be resilient to begin with, so that the next pandemic that comes along, the next tragedy that comes along, unfortunately, we know it will, we have families and institutions that are set up to have them be strong and resilient already, so that it's not a, now our families are in crisis, what do we do? So that is the real goal of this.
Anything else, Ann?
No, thank you.
I just have a couple questions for you.
Sure.
Okay. How many families do you have involved right now?
We have, I think the last time I counted, we have around 50. So we're about halfway there, 50 out of the 100 families that we're shooting for.
So you have about 100 participants.
Yes, not all moms and dads have agreed to participate, but we've actually had a pretty good rate of mothers and fathers both participating at this point.
Okay. And then second, what's your total ask? No? Showing 74?
Around 74. 75.
74.9.
Yes.
All right, that's all I have. Unless my colleagues have.
One more question,
Sure.
if I can, because never know if we'll get to see you again before we make a decision. So hopefully you don't think this is a tough one, but how would you answer the question and say, hey, why are we using, county money to fund an academic research? I thought it was supposed to be for community types of research, data, events, other areas. What would you say to that question if somebody asked you that?
Sure. While I'm from Clark, and I will use the data to hopefully publish academic papers, this is a community engaged project where I'm using the data specifically to make a change in the community. So I'm hearing from community members about their own issues, and then using those results to bring that back into the community to make real change. So I'm not just using their data so I can go to academic conferences and pad my CV with papers. The goal of this is to get to know the community and their true needs and also their strengths, and then be able to share that with our agencies, our schools, any interested stakeholder to implement programs that continue to promote resilience. So it is very much a community project and not just an academic project.
Thank you very much. Appreciate it.
Sure.
Thank you very much,
Okay.
Doctor.
Thank you.
We will move along to the VNA.
I'll bring that way down.
Introduce yourselves, please.
Sure. So my name is Stacy Killian. I'm the director of the Visiting Nurse Association. And standing next to me is Brittany Hubank. She is the manager of the Visiting Nurse Association. And together we've spent a lot of time working on this program throughout COVID. And so I thought it'd be fitting that we are both up here and kind of going over this proposal for you. So we appreciate the time to be here. Right now, VNA has a representative payee program that provides financial oversight to individuals who receive Social Security disability. And what we do is we manage all of their financial accounts, with the priority being making sure their basic needs are met. We're making sure that they have housing, food, shelter, clothing. That's our #1 priority within this program. Part of what VNA does as a payee is we also take a look at beyond that and provide some case management services. We help connect them to community programs. We take a look at, what their needs are, if it's helping and assisting with Medicaid applications or getting them enrolled in SNAP benefits, things like that. And so we really try to go just beyond the financial aspect, but really get to know our clients. And some of the services on our slide presentation are listed there that we do help them with. And so just kind of a little bit beyond that financial control. Next slide, please. So our representative payee program is currently funded in a variety of ways. First is we can provide monthly fees for our clients, as we are a fee-for-service organization. And what that means is Social Security, you can apply to become a fee-for-service organization to be able to bill the patients a small fee if they can afford it in order to provide the payee services. We must adhere to Social Security standards. So we get audited by them. We must supply policies and procedures that go along with what they expect for those that are providing the payee services, and it gives us a higher quality program. So we are able to use some of that funding to help fund our program. We also are a funded partner through United Way, which just provides some stability in our funding for rep pay and continuing to service at the level that we are now. We also apply for local donations, grants, things in our community that help us supplement that funding. Next slide, please. So the next 2 slides just kind of show some of the statistics that we currently collect. Right now, we are serving 70 patients. That varies throughout the year as some drop off. They may become their own payee. They may have a family member that steps up to do that for them. They may move into an assisted or long-term care, or we may gather more. Our current goal right now is actually 75 patients. So we expect to add on another 5 patients here very soon. And that's kind of where we're sitting at now with our staffing. But as you can see, those are some of the services that are utilized by our patients. Next slide, please. And then here's some more of our statistics that we do keep. And we do keep a variety of those. And the reason for that is so we can look at the gaps, look at the needs of our patients and where we're not serving them as well as we could, or where we can improve on some of the services. So as you can see, a lot of our individuals are enrolled in SSI or SSDI. They might be enrolled in various housing programs, whether it's residential homes, group homes, Section 8, things like that. So a lot of different opportunities there from them as well. Next slide. So what brought us to our proposal to you is when we started working with these patients throughout COVID, we noted that they're some of our most vulnerable. A lot of them have a lack of peer support in the community. They don't have family support. Many of them rely on us at the VNA as their sole support, not just for financial resources, but their social as well. We started to see COVID caused a lot of barriers for this group. Their isolation and anxiety, as we were staying home and we were shut down as a world, that caused a lot of brain health issues for this group. It increased their anxiety levels. It cut them off from the world. A lot of them had food insecurities. They rely on free meal sites and places like that. And so that's their only social outlet and also a huge nutrition outlet for them. They, depended on public transportation, and then comes in the anxiety of, will I get sick if I get on a city bus or things like that? So they weren't going out as often as they would have in the past. And, you know, just navigating the healthcare system, many of them do have physical or brain health issues. And so they are at higher risk for complications with COVID. And so being able to navigate when to call a doctor, when to keep themselves safe, or things like that. We also noted that, you know, we saw a rise in substance abuse with our patients. Right now, we know that 25% of them, just based on the data that we collect through our client surveys, have admitted to have used substance abuse over the last year. So to us, we saw a little rise there, and it's concerning. A lot of them have communal living if they're not, you know, in emergency housing with shelters. They may be living with other people or in group homes, would put them in higher risk for COVID. And so what really started us looking at what can we do for this patient population? How can we make it better? Should, you know, evidently if we have another pandemic in the future or something similar to that, how can we improve their lives so they're not hit this hard next time? Next slide. So our proposal is kind of two parts. The first one being is just some one-on-one goal setting, is be able to spend that additional time with each individual to provide a care plan, to start looking at what their individual needs are. And it can be anything from, you know, just setting personal goals, whether it's health or financial, teaching them to save, to look towards the future, and determining what their personal goals are and how can we better navigate to get them there, to actually set some personal goals. And along with that is enhancing that individualized one-on-one courses, is providing group sessions, peer support sessions, so we can bring in experts in the community on cooking skills and, you know, predatory lending skills. And one issue is also teaching people how to be a payee and working with Social Security. So what our goal is there is to bring in those experts in the community, further our collaborations, and help enhance what we're doing with the one-on-one, allowing our patients and their family members to come in and enrich their lives, whether it's through improving chronic disease management or their overall health, or, you know, learning more about substance abuse resources in the community and things like that. So we're kind of hoping that between these two parts, we can really help them reach their goals in the future, and then give them better tools to succeed on a better level individually going forward. So I'm going to turn it over to Brittany. She worked a lot with our patients one-on-one, and so she's got some opportunities to talk about the goals and the outcomes we expect.
Hey, everybody. So just to build on what Stacy said, so in looking at where we were at in hindsight, always being 2020, what we really wanted is to come up with a way to help this particular demographic be more resilient, think more critically, and problem solve more independently, with the trickle down of increasing overall health when they're just at baseline and not in a crisis situation. So in looking at kind of overall goals and outcomes of what we hope this project will do and are confident in that this project would do, is develop stronger peer networks. As Stacy said, a lot of our individuals, they don't have large peer support groups. And a lot of times that's where all of us find, you know, that ability to vent and that healthy outlet, and that knowing that someone's always there for you. A lot of the people we serve don't have that. And so being able to, through these group sessions, bring them into a healthy, safe environment where they can meet other people that are very similar to them, that maybe have similar struggles and have similar wants and needs that they do. So that would be ideal, and help decrease that isolation going forward, not just within a pandemic, but just day to day when they're at their baseline. Improved brain health, decreased chronic disease, improved nutrition, just all of those things to make them overall more healthy, and able to live longer, more full functioning lives, bringing in those experts in our community, which we have a lot of, to teach them simple ways that they can do that and simple ways they can improve those things. One of our largest goals, payee services are not incredibly common in our area. There are several entities that provide the service if you are a resident of their facility, so different residential facilities. When you're looking at independent payee services that serve the general public, we are the only one within an hour-and-a-half radius. The next closest is in the Cedar Rapids area that serve general public. It makes it very difficult for those who are living on their own in the community, and need a payee to find a payee. And so to be able to partner with Social Security, who has a great toolkit for people that are interested in being payees, to teach you all about that and support you along the way. It's not, here's your tools and then we're done. But being able to get that out there to the community members and the family and peer support that might come into our group sessions, just so that they know that it's out there and it exists. And our participants can then bring them into these group sessions to learn more about that, with the overall goal of increasing access to payee services ultimately for the community. That would be of great benefit for the county and the residents within it. Next slide. So some of the things that we plan on measuring and evaluating. So there's a few things we're going to monitor, obviously attendance in not only the individual sessions, but also group sessions. We're also going to look at number of people who complete those monthly education courses. So maybe they don't come to all of them, but that way we get a count as to how engaged they are throughout the process. And then long-term, whatever goals we set with them long-term, monitoring that as we go through the process with those individuals on how well they're doing on maintaining or meeting those criteria and goals. And then we do plan on mailing out or doing surveys with them, letting them tell us what their perception is, how they feel they're doing in some targeted key areas to kind of measure that success as well, and to kind of help us gauge where we need to go. Are there needs that we're not meeting for them that we can kind of increase upon? So here's our overall budget for you. So overall, we're requesting $76,560 to get this started. So the funding will kind of do the startup materials and help us kind of get this thing off the ground. We do have a contingency plan if we weren't to get fully funded. So some of the things, we'd kind of take a tiered approach in cutting some things out. One would be our admin cost off the top. If we don't get fully funded, we would remove that. We would look for supplemental grant funds to cover any potential gaps. Look at decreasing the project from a 2-year project to a 1-year, depending upon funding. And then if we need to eliminate any incentive items, or if we need to reduce the group classes, or just to focus on one-on-one support, we kind of just tier it down and kind of have a step down process to that, depending upon what funding would look like. And then where we go from here, sustainability wise, we are fortunate to be a funded partner with United Way. So we do have stable funding there. And as Stacy mentioned, we do have our fee-for-service agency status with Social Security that brings in some funding there as well. So our hope is to be able to incorporate this going forward with our grant applications to cover the routine costs such as staff time or things like printer paper, things like that, that would be more routine, regular, ongoing costs. But what this would really do is, like I said, get us off the ground, get all those startup materials, get all the printing, get all of the foundational curriculum if we had to purchase any of that in place. And that way we could get off the ground and running and go forward from there.
And I think I would add, in terms of sustainability, I believe that, you know, this is going to give us a baseline so we can see what works and what doesn't. Because what we want ultimately out of this is something that's going to have a lasting impact on these patients and our community. And so as we go through and we start doing the surveys and we start looking at what is it they truly need? Are we missing the boat here? Do we need to navigate in a different direction? Do we need to provide additional support in some areas? And that's kind of what our hope is this funding will do that. So then as we go forward and we write additional grants, we can take a look at more tailored what we need and what outcomes came out of this.
Thank you, Stacy. Any questions, Jim?
Where would the headquarters of the classes be?
So we would take a look at our patients and where they all live, because they do live throughout the county. And so we would try to make sure that it's accessible everywhere, not necessarily just across the street at the VNA, but using some of our community partners and maybe trying out in the county or in more traffic areas. So we would take a look at what would be best, because we do know a large percent of this population relies on public transportation. And so we would want to make sure that that would be available to them and they would be able to access it.
Very good. Thank you.
Ann, do you have anything?
Yes, thank you. Stacy, the McDonough Foundation has funded this project for a number of years. And so it's interesting to me to see that you need startup funds. So what is the difference between your ongoing project and the need for startup funds? I'm not understanding.
So I think what the main difference is, Ian, is right now this program is fully functional. We are hitting the goals that we want to hit. We are providing a financial oversight for all of these individuals. We're making sure that their basic needs are met. This additional funding and these additional requests will allow us more time with them. Will give us that one-on-one. Let's start looking at goal setting. Let's expand what we're currently working on and what we're currently helping you with, because right now a lot of it's crisis control. It's making sure that they have the stability, they can meet those basic needs, but yet we can also help get them to the doctor or here. This is just going to give us more time with them and more ability to let them set goals outside of traditionally the case management we currently do.
So you VNA loses money right now on every client that you serve through this program, correct? That's the reason you need to write grants for philanthropy to bridge the gap, right?
Correct.
Okay. And I don't know if you know what the cost is for each one of the individuals. That would be a question I would have. You may not know that today, but I still don't understand if you're currently losing money on each individual that you serve. Why are you increasing the numbers of people that you are serving? How many do you currently have and how many do you want to grow to?
So currently we serve 70 and we want to grow to 75. And the reason we are doing that increase is because we always have a waiting list. There is always a waiting list of individuals. And these are some of the most vulnerable individuals in our community that need the help. And so being able to serve more people is going to better our community and better these individuals. I mean, there is such high risk for so many different things. And so any little bit that we can do, and that's why we continue to do it. I think it would have been very easy years ago to say, you know, there really is no stable funding here and we are losing money, we shouldn't be doing this. But at the same time, as being a good part of this community, we want to help those that cannot help themselves. And so that's why we continue to grow and expand this program.
And I also know you didn't mention this, I don't believe, but certainly every person that you help, you remove them from the chronic homelessness, right? So their stability with you becomes, you have a person who have housing, they're not on the street.
Absolutely.
So, yeah.
And you know,
go ahead.
Oh, sorry, I was going to add in something I didn't mention earlier is those that are mandated by Social Security to have a payee, if they do not have an approved payee by Social Security, all their benefits are suspended. And so they don't receive any financial benefit until they can get a payee in place. And so that's where you see the increased incarceration, homelessness. You really see it highlighted there because we've seen patients that were homeless for years and it turned out that they were eligible for Social Security but never had a payee. And so, and that's incredibly sad to have to know that that's going on.
Is there any way to increase funding for only item number 1 and not item number 2? You have 2 parts of your proposal. So you want to increase from 70 to 75. What if we say, what we really should do is increase from 70 to 80 or 90?
Absolutely. Absolutely. And I think it all kind of goes along together. And the more people that we can serve within this program, the better off our entire community is.
Do you know how much it costs to serve an individual? How much is not funded?
Offhand, I do not, Ann, but I can certainly follow that up with you. I do know I have that in my office.
Mm-hmm. Anyways, I just look at some of your budget items, you know, binders, workbooks. You know, I still don't see what the startup costs are. I can understand that you need more staff to address the needs of more people, but I just don't understand what the new service is.
Sure. And I think a lot of the funding is increase, is for incentives, is to get them to participate in these goal settings and this care planning. And we really want them to be actively engaged in order for it to work. And so that is a large portion of the budget. And it's just making sure that we have all the office materials and things that we need. And because currently, as you know, there is no budget for that for this program. That's, definitely on the bottom end. So anything we can do. And we do know that you guys have received a lot of applications and definitely for a lot more money than what's available. And so we know that even being partially funded would be a gift here. And we know to prioritize what those needs are and making sure that we can serve more and provide that one-on-one case management for that group.
I just have two more questions for you, Stacy. So the $76,000 that you're requesting, is that for 2 years, or is that you need $76,000 each year for 2 years?
For 2 total years.
So 76 would fund 2 years.
Correct.
Okay. And then do you have a contract with the East Central Regional Governing Board for any of the work you described? I mean, you talked about brain health many times.
We do not. We do not currently, but we can definitely, that's a direct and I think we need to go to.
I would be surprised if the region maybe isn't doing some of this already in Lynn County or Johnson County, through some contract form. But again, it would never cover your costs.
Sure.
Thank you.
Thank you. We appreciate your time.
All right, I just had one question for you, Stacy.
Sure.
You have materials, printing, binders, and workbooks, supplies, 3,000, and down below you have materials for attendees, supplies, 6,000.
And I think what we were looking at there is the first supplies for 3,000 would be to set those goals, is to have those workbooks. And we've looked at a number of things that they can use to have like templates for goal planning for things like that. Going down below is any supplies we would need for those group sessions, for those educational sessions.
That's all I have.
Thank you.
Thank you, Stacy. Thank you, Brittany.
Thank you.
We'll move along to the Emmaus Bible College.
Hi. Good afternoon. My name is Joe Abdi. I'm the Vice President of Finance and Administration for Emmaus Bible College. Born and raised, lived the whole life in New Jersey. My wife and 4 children moved here 2 years ago, just in time for the pandemic. So if we go to the second slide. So our request was for a dishwasher, and hopefully I'll answer the questions on why a dishwasher should be funded, but just a couple quick notes about Emmaus. It was founded in 1941, moved to Dubuque in 1984 from Oak Park, Illinois. It's accredited by HLC and ABHE. At any time, we have somewhere between 200 and 250 students in the community, along with 85 full and part-time employees. About 150 live on our campus. We have 35 majors and minors. We have a partnership with University of Dubuque, where you can attend our school for 3 years and then complete a major that we don't offer at UD, and our nursing program is in partnership with NICC. One of our programs that we have that every full-time student takes is called Servant Leadership Training. And each student is required to provide 60 volunteer hours of community service to Dubuque during the academic year. So that equates to 10,000, 12,000 hours that our students spend in the community. If you do the math, that's about 1,500 days a year if we have 12,000 hours fulfilled. Here are some of examples of places that our students serve at: the Dream Center, the Arboretum, the schools, the Dubuque Food Pantry, Almost Home Guest House, United Way. You could see them on the presentation. But healthy Emmaus community leads to a healthy Dubuque community. That's why we strive to be as healthy as possible. If we go to the next slide. So we had taken many steps to mitigate COVID-19, as I'm sure the other institutions in the county have done. We had social distancing in our dining hall. We limited seating. We staggered times. We provided no self-service. Every meal was served to people, no to-go containers. So part of our experience at the college, the staff and faculty eat with the students every day. It's a very one-on-one environment. So that's been limited during this time, but that's also why we strive for a healthy environment, since there's so much contact between the students and the faculty and staff and the community. So why a dishwasher? Our ask is for about $35,000. We have a very old dishwasher at Emmaus. We limp it along. It's over 20 years old. We've done all the repairs. How long will it last? I don't know. If you have a 20-year-old car and you keep repairing it, someday soon, is it going to be 2 months? Is it going to be 2 years? There's going to be something wrong. So our current dishwasher can only get to the proper temperature for sanitizing for a short time each day. So as a result, we've moved to a lot of paper products, plastic products to keep everything the best sanitary environment we can. But a new dishwasher will allow us to run it constantly for each meal service and then sanitizing everything. And if a dishwasher runs at the proper level of what's called a 5 log kill, it effectively kills 99.999% of bacteria, of viruses, and other pathogens. So I highlighted virus since that's what we're focusing on. Next slide, please. So as I said, our current dishwashers let us to use more disposable products. That hasn't been a good use of our time, our money, and the environment. You know, we're trying to be a good steward to the environment. Our waste went from 3 days a week pickup to 7 days a week pickup, just for all the waste being generated. But the new dishwasher will allow us to confidently return to using silverware, dishes, cups, since we'll be able to continually wash them properly. So hopefully, having a healthy campus at Emmaus provides a healthy community as well for Dubuque and the county, as we do so much interaction with the community. Questions?
Thank you. Jay, same order. Joe, thank you for being here, and a belated welcome to you, your family, and your kids to Dubuque County. So we're happy you're here, and I'm glad you came to the presentation, because it's probably tough to, you know, hey, we're pitching the dishwasher. Right. But I learned something new about Emmaus Bible College today with your servant leadership training, and that seems like a wonderful program. So I appreciate you guys continuing to do that and working throughout the community. My one question is, yes. You're a private college. Tell me a little bit more about any other types of community events you might have on campus where, you know, the actual cafeteria may be used.
So we do have annual events. We have a Christmas program where the community comes in. We don't use the dining hall for that. We do have an annual conference called Iron Sharpens Iron, which happens at the end of May. People come from various parts of the country here. It's a 3-day conference. We provide room and board and dining for that. This year, this summer, at that time, we have 4 conferences going on concurrently, a lot of pent up demand things that have not been able to be held. So people are asking, can we use your facility? Can we use your facility? So we have a prison ministry conference and actually one international conference coming as well, and a archivist conference, and they'll be running concurrently for 3 weeks where they'll use the facilities and the dining hall at that time.
Thank you.
Ann?
Joe, can you tell me, have you applied for any other grants for this?
We have not applied for any grants for this one. I mean, we have, as a higher education institution of higher education, we received HERF funding that we've used for classroom upgrades, for PPE, for other COVID mitigation, but those funds have been exhausted at this point.
Just seems at some point your own return on investment would have required you to purchase this dishwasher.
Yeah, we have purchased it, and it's going to be installed on March 7th. It was just a matter of getting the funds for it. And, it's an important project. We're moving ahead with it regardless of the outcome today.
So it's just a capital project on your campus and you're still looking for funding for that if possible.
That's correct.
Thank you.
I think I would have, obviously, I don't understand the dishwasher that size, but it sounds more like a water heater issue than a dishwasher issue. But
Well, it's both. But we put in a new hot water heater system in the kitchen too. That's separate from this. When we made the ask, we knew that the dishwasher, commercial grade one, cost $35,000. Then when they come in to do the specs for it, they're like, well, you need this much pressure, this much electrical, your water heater is not proper, and you find a bunch of ancillary costs associated as well. I didn't include that, but that is part of the issue. But even after upgrading all of those items, the 20-year-old dishwasher still can't handle the load that it's required.
okay. That was all I had. Thank you very much, Joe, and thank you for what you do for the community with the servants.
Thank you. You're welcome. Do we stay for the rest, or do we?
You're free to leave if you'd like.
Okay.
If you want to stay, you can.
Thank you very much.
Thank you. Moving along, Hillcrest.
My name is Mike Fidgen. I'm the CEO of Hillcrest Family Services, which serves Dubuque County with facility-based and community-based brain health services. Our main administrative offices are located on our campus at 2005 Asbury Road. Next slide, please. Hillcrest is here to refresh on 2 proposals and presentations for ARPA funding, which have been brought before the Board of Supervisors previously. The first proposal is for enhancements to the AccessMe Care platform Dubuque County initiative. The second proposal is for the Qualified Opportunity Zone Telehealth Resource Center project. I am presenting with an understanding that there are many requests for ARPA funding before the Board of Supervisors, and this presentation will be limited to 15 minutes, inclusive of any questions from the board that they may choose to ask me. I've been provided our previous applications for these specific funding requests by Ed Raber, and I will present with the understanding that the board has reviewed these requests during past work sessions and perhaps in preparation for this meeting as well. Next slide, please. The first proposal involves the AccessMe Care platform and enhancements above and beyond the standard platform implementation and subscription costs. These enhancements will further drive the collection and analysis of community data resulting from the use of the Hillcrest Access Hub, the Telehealth Resource Center, and the movement of county residents among participating organizations that collaboratively coordinate care for our county residents. The current platform has increased traction and grown to 32 participating organizations joined together to improve access to care while also reducing stigma and other barriers to care that prevent those in need from getting the right care at the right time, place, and cost. Too often, lack of access, stigma, and various social determinants of health and poverty result in care being postponed or avoided by vulnerable populations until their care needs are urgent, costly, socially disruptive, and unnecessarily thrust upon law enforcement and emergency care settings. Next slide, please. The AccessMe Care platform has recently achieved an optimal threshold of community engagement among participating organizations to implement the referral management functionality. This functionality is currently being beta tested within Hillcrest and will be rolled out to the participating partners within the next 60 days or less. Monthly community forums among participating organizations were initiated in February and were attended by 25 participating organizations in the opening session. The use of AccessMe Care has increased more than 300% in the past week alone as a result of increased community awareness of the platform. The monthly forums, in addition to ongoing organization onboarding and trainings, are priming the pump for improved communication and collaboration among community care providers and agencies, providing resources and coordination to residents in need. As the interagency referral management capability is achieved in the coming months, data capture will drive countywide data analytics, displaying de-identified patient trends in care utilization and potential service and resource gaps in our local ecosystem of care. Next slide, please. The total requested ARPA funding for AccessMe Care related enhancements is $232,866 as last presented to the Board of Supervisors in our January work session. Compared to our original proposal, this includes a subtraction of the Fund 10 balance awarded amount for continuing the base platform into a second year. It also removes $48,000 of Hillcrest administrative costs, which Hillcrest will absorb through charitable contributions. The funding being requested will enhance program alignment and quality improvement initiatives associated specifically with current needs of our Access Hub and other community-based programs, which are increasing in demand as a result of client, colleague, and community stressors caused by the pandemic. Hillcrest operational initiatives which will benefit from this funding include integration of AccessMe Care into our electronic health record and process mapping Hillcrest's current operational and clinical pathways to develop better pathways for implementing value-based care models. These models prioritize health outcomes over an endless fee-for-service model. The e-triage board supports the Access Hub by determining wait times and tracking of patient volumes in real time. This information will be valuable to mobile crisis and law enforcement to understand service availability when engaged with non-medical and non-criminal community interventions. Care planning documents allow for improved discharge planning and assignment of next steps and follow through for patients coming into care at the Access Hub. As part of the enhancements, which will directly benefit the broader Dubuque County residents, greater access to data and community analytics will improve overall access, quality, and cost of care. At the same time, the data collected will provide the Board of Supervisors and platform partners with on-demand data analytics for the county. The data will create opportunities to generate additional funding for providers and patients' needs. An example of this was demonstrated last year when focus group information at the county level allowed Hillcrest to draw down almost $400,000 of Federal Communication Commission funding to underwrite the cost of internet services for between 500 to 1,000 residents of Northeast Iowa over the next 3 years. The funding being requested will allow for more robust conversion of the platform to Spanish and Marshallese languages as well. Finally, data gathered will also help to deliver health promoting content and resources contextualized to the needs for care and unique gaps in care throughout Dubuque County. What we are asking for with these platform and operating enhancements under the AccessMe Care proposal allows us to put the finishing touches on the infrastructure necessary to move Hillcrest away from fee-for-service and toward value-based care delivery for the residents of Dubuque County. This is aligned to Hillcrest's strategic plan and Iowa's overall direction for mental health care delivery as supported by the governor, Director Kelly Garcia, and the recent request for proposals soliciting additional managed care organizations to manage the overall public health care spend for the state of Iowa. Next slide, please. The Qualified Opportunity Zone feasibility study request is essentially a mechanism to allow Hillcrest to produce a value-based care demonstration that would allow for an investment of $6 to $10 million in local real estate, jobs, and a social impact business model that moves our organization to a payment model that does not rely entirely on fee-for-service funding. This study involves the convergence of Hillcrest's work to date in strategically realigning our business to 1, increase community-based care service capacity, 2, expand the county's crisis response capabilities for non-medical and non-criminal mental health crisis by leveraging our Access Hub, 3, allow for the collection of real-time data and data analytics to formulate more appropriate and cost-effective care models that focus on value and health outcomes, and 4, increase access to quality care by building a broader array of remote telehealth options to reach hard to reach and hard to serve county residents who have been further marginalized by the impact of the pandemic. This project is an investment in the future, driven by the dire straits we can see even more clearly today in a system of care over relying on fee for unlimited service models. This model is neither clinically most effective nor financially sustainable. The inability to study and change this model of care will only further the workforce recruitment and retention issues, access issues, and quality of care issues that we are suffering on a county, state, and national level. Final slide, please. Thank you. Any questions?
Thank you, Mike. Jay?
Thank you. Appreciate that. Some of your proposals are very progressive, the entrepreneur or the opportunity zone one in specific. So maybe I'll start with that question. From my understanding, it's not what you're trying to accomplish with that study is to learn more about that opportunity and, as you said, to change possibly the funding mechanism and ultimately the outcomes of the services you provide. Why do a study that might be on the edge, so to speak, in my own words, in Dubuque County? And why have Hillcrest be the organization to lead such a study?
Yeah, it's a great question. So the Sorensen Impact Center out of the University of Utah's MBA program has been looking for an opportunity to demonstrate within the Qualified Opportunity Zone federal initiative within a rural market. Heretofore, there's been low deal flow in qualified opportunity zones across the country. The majority of that deal flow has been real estate in cities and municipalities in high density population areas that have significant issues of poverty. And it's also looked a lot like regentrification of impoverished communities rather than something that has demonstrated a significant social impact that, you know, rising tides lift all boats, right? So in this case, we were approached as a result of our initiative with AccessMe Care, which became known to the Sorensen Impact Center, as well as the reputation of Hillcrest within Iowa and within Dubuque, to have a continuum of services that was appealing, that had rural access or remote reach, both by having localities and offices in remote counties, as well as having a telehealth infrastructure, albeit that it's been more robustly developed as a result of the pandemic. So the opportunity to have Dubuque demonstrate through Hillcrest this feasibility study that has to go through about 3 phases of gating criteria in order to achieve the ability to create a private-public partnership, Medicaid funds, and private investor funds, a real estate component to it, and then a model of social impact, which for us looks a lot like leveraging the Access Hub remote telehealth and some jail and ED diversion models that we would run past the Sorensen Institute when we enter into that part of the study with them.
Appreciate that feedback. It's a very intriguing concept. My second question, maybe my last one as well. The AccessMe Care is relatively new over the last couple of years. And it appears from what you report and what I've seen when I've done my tours that it's working and productive. In short, I know you went over it in some of your PowerPoints, but why do we need to do more than what we have today?
Yeah, I think the pieces that we've itemized in our original proposal, and then as I said in this presentation, they've been adjusted for the award that we received for second year funding of the basic platform, allow us to more broadly provide data and data access to the county and to other providers on the platform, as well as the components that I talked about here that have synergies with the walk-in center, the access hub, that just create a more robust interaction with partners in terms of both data and awareness of how services are being used and where there's gaps in services right now.
Thank you.
Ian?
Good afternoon, Mike. Good evening. Thanks for being here. I don't see progress in the last quarter of the year. The funding is the same request that you've put forth before us twice before. Certainly with the amount of funding that's available from other funders and other sources looking at rural health and things, have you been submitting other applications to other potential funders?
Yeah, I guess I'm not entirely following your question, and good evening, Ann. The funding that we're requesting is what advances these additional opportunities beyond just the building of the ecosystem and the technology contextualized to the current group of partners, which is growing on a daily basis. As far as reaching out to additional funding sources, yes, we continue to reach out. We don't rely entirely on the Board of Supervisors to fund various initiatives. We're looking at the fit for the ARPA dollars as a federal initiative that certainly we think dovetails with what we're trying to do at both a county and a broader Iowa level for Hillcrest, as I've described here and in the prior proposals.
So within the last month, the AccessMe Care increases by 300%. Is the cost that you need, is that going to be ongoing regardless of volume?
There's different costs. There's the platform cost, which has been about $80,000. I'm rounding up a bit, but I'll err on the high side in its initial year, and then $77,000 thereabout that was funded by the Board of Supervisors under the Fund 10 balance the last time we were in here to move us into the second year, which I believe we entered as of October 21st. So we're into our second year of building the ecosystem and the platform. These other things that have been presented as line items during this presentation and in more detail in the proposals that are in the hands of the Board of Supervisors itemize those items that would be additional value, we believe, to both residents and to the county and to the county boards of supervisors in terms of broader access to data and the ability to determine what type of data you want to see, provided that it's de-identified.
Have you received any funding from the East Central region for AccessMe Care?
In our initial year, we were funded by the East Central region.
And what is the status now?
We haven't received. We received our second year of funding from the Board of Supervisors, and that's where we are as far as the maintenance and ongoing platform cost for year two.
Could you not apply to the East Central region for funding for AccessMe Care?
I suppose we could. We were looking at opportunities under ARPA, and we feel like this fits for the purpose that those federal dollars were drawn into the state of Iowa and the county of Dubuque.
Does that mean you're not going to apply to other grant funders?
Now, we'll apply to the grant funding when that grant funding fits what it is that we've proposed here. Heretofore, we haven't seen another opportunity with the ECR since they last funded the first year of the proposal for our initial kickoff.
Yeah, the ECR is returning more than $2 million to the state.
Yeah, I wish that weren't the case.
Me too. So I'm wondering why you don't have an application before them. I don't have any other questions.
I don't have anything. Thank you, Michael.
Thank you, Harley. Jay, Ann.
Next, we'll go to Mercy One.
Hello, Chairman Potoff, Supervisor McDonough, and Supervisor Wickham. Great to be with you. I'm Melissa Springer, and I'm Vice President of Mission Integration for Mercy One's Eastern Iowa region. And with me today, I have Susan Hafkemeyer and David Moore from the Mercy One Health Foundation. So grateful that they could join me today. A while back, we had the opportunity to come before you and share our vision for a Mercy One mobile medical unit with the idea of serving anyone that might have a barrier for care. And despite pandemic delays, we were able to receive that unit late last year. And we believed just at the perfect time to aid and enhance Dubuque County's public health response to mitigating COVID-19. We worked with community partners, with our county health department, with the Visiting Nurse Association, the Dubuque Community School District, whoever we could, to be able to not duplicate any service that was already being provided, but maybe to get into a nook or a cranny of the county to provide vaccination and booster and pediatric vaccination. So that largely in the first 3 months that we've had this mobile medical unit launched has been our emphasis, a very intentional effort on mitigating COVID-19. And we see today that the Centers for Disease Control is now talking about a second booster or a fourth vaccine. So we know that our work is not done in that regard. With that being said, during the pandemic, we were able to work with Unity Point, Finley, and Hillcrest Family Services on conducting a community health needs assessment. The results of that community health needs assessment to inform our work or give us our marching orders in terms of what that mobile medical unit needs to be doing. And that's really the beauty of a mobile unit, is you can kind of pivot it to meet whatever is the need of the community. So on that needs assessment, we were able to analyze significant community health need around access to care, around obesity and brain health, of which you've heard much about, whether it was Fund 10 balance funding or this American Rescue Plan Act funding or East Central Region funding. That is where our intention lies moving forward, continuing our effort to mitigate our pandemic, continuing to decrease barriers for individuals in accessing care, because I have to tell you, in this first 3 months, it's been interesting. There's been a handful of individuals that have accessed vaccinations and boosters just because it was radically convenient. If that mobile unit was pulled into the mall, you know, and so that really was our focus, to reach everybody, to get as many vaccinations out as possible. But the broader vision of that mobile medical unit is in fact to assist anyone that has a barrier to health care. So whether it's vaccination, flu shot, some sort of primary health exam, well child visit, brain health, diagnosis and treatment, whatever it may be, anyone that has a barrier to care. So not just poverty, not just underserved, anyone who has a barrier. And we know that more and more people have barriers now, post-pandemic. So that really will be our focus moving forward. Like we've talked about already this evening, the requests in front of you are broader and bigger than the funding that you have to work with. And I learned a long time ago from this supervisor's bench, the importance of looking for alternative funding streams to help with sustainability of ministry to people who need it the most. I learned that here. And so thankfully, in working with our foundation, we have been able to secure some other dollars since our initial request was submitted to you September 15th of last year. So that's very exciting. Between Mercy's $250,000 investment of the Winnebago customized with 2 exam rooms itself, our operating budget of another $250,000. And maybe you'd like to talk about, Sue, some of the funding from alternative sources.
Good evening, and thank you for allowing us to be here and share this vision of this pilot project with you. As Melissa said, this is a really critical project, and we don't only represent the Dubuque Foundation, Mercy One Dubuque Foundation, but we also represent the Dyersville Mercy One Health Foundation. And both of our foundations, our boards of directors are very excited about this project and the services that it provides to our county and all of the residents who need it to, as Melissa shared, defer those barriers and give everyone access to care. I think what we can share with you is that we did not want to wait to provide these services. We wanted to hit the ground running. So my colleague David and I have been working very hard to secure funds. We've raised $177,000 since September, since we've made our request to you so that we could get started with this very important work. And that has come from a variety of sources, some family grants, and a number of private sector donors who see the vision and the need for this particular care and the uniqueness of the offering in being able to access every individual who needs our assistance, not where we are, but where they are, and meet them where they are. So it's been very rewarding work and a top priority for us at the foundation to assist in this very important work. So thank you.
Thank you, Sue. I would just say really in closing, it was the Sisters of Mercy who were pioneers in street medicine, kind of getting out and meeting people where they were to provide care to them. And I can say in being a member of the delivery team so far, it's been quite impactful working with families in neighborhoods, maybe when they don't have transportation or another way to get questions answered. I'll use an example of a 3rd grade Hispanic American child in high priority zip code 52001 that was very scared about that he would die of COVID. And the school reached out and said, is there anything you can do? So we had some documents translated. This child took them home, was able to have conversations then with the family about vaccine hesitancy. And then being in that schoolyard at 6:30 p.m. at night, it was dark, it was cold. And here comes this family of 5 walking from the neighborhood, a mother, a father, and 3 children to receive not only their COVID vaccination, but also their influenza inoculation as well. And it was more than that. It was more than providing that care. It was being with them, having this authentic presence with them. And we've heard about, like telehealth is excellent. The payee, the research, these are all really, really good ideas for use of these dollars. What I would hope, what Mercy One would hope, is that the county is our partner in this work moving forward at some level. And if you would consider a lesser funding amount, our ask was bold at $1 million initially. That was back last September when we didn't have any other funding streams. We have secured, thanks to David and Sue's efforts, some wonderful funding and a lot of good energy and momentum around this work. So with that in mind, as an example, if you would consider 300,000, let's say, we would use that money, 100,000 in FY23, 100,000 in FY24, 100,000 in FY25. We would spread that money out and work with you, the county, to help us to inform our next steps in meeting any gaps and needs that this community has moving forward. And we just thank you for your consideration and wish you much luck with your discernment of where these funds go. And we are submitting other federal grants. I really enjoy doing that, and they're long shots sometimes, but we do have a United States Health and Human Services federal grant in progress, and so fingers crossed on that. But more than the funding itself, the opportunity to partner with the county in this critical work, this life-saving work that will address obesity, that'll make sure everybody has care, that'll make sure if there's an overarching brain health need or a substance use disorder, the care is provided, that individuals feel heard and held reverently and can get the help that they need. So thank you for your consideration.
Okay, do you have any questions?
I'll jump into question. Thank you for your presentation and the idea. And probably more importantly, thank your organization and all your staff members over the last 2 years. I know it's been a tough haul for those in the health field. So we appreciate you being there and taking care of the community, especially related to the vaccinations. Once those hit, certainly our area at Kennedy Mall and then in Piasta, and now with your mobile unit too. I think that was one of the questions I had when you had first got the RV up and running. Were you going to deploy it for testing and vaccinations? And you said yes, and I saw in your report that you've done that. So thank you and congratulations on getting it up and running. One of my questions is related to, is there a purpose for this type of asset for emergency management?
Could be used. We've had the opportunity to work with our emergency management team in terms of just making sure they all were able to get on board, see the capability that it has. I know Mary Rose put our number into her cell phone, so I mean, it very well could be deployed in that regard. We kind of thought we'd do this phased in approach, right? So we're launching it at Christmas and winter. So we kind of keep it closer to home. We would focus on vaccination, and then this phased in approach, we'd kind of blossom and continue to move forward in other ways. But yeah, I think so.
Well, thank you for considering that. And my second question would be, would Mercy One generally be open to an agreement, so to speak, that there would be some metrics related to number of events that you attend or number of patients that you actually serve related to the funding?
Absolutely. So our goal in year one was 2,000 patient visits or encounters, and we've had 1,308 to date in just a 3-month period. Those are unique encounters. Many of those individuals have accessed the mobile unit on more than one occasion, but 1,308 pediatric and adult encounters in just that 3-month window in the winter. So we know that we're going to be able to achieve that goal of 2,000, and my goal now has been moved to 10,000 Dubuque County residents having access to this, whether it's radically convenient for them or whether they're experiencing some sort of barrier, which again, you've heard me say, when an epidemic and a pandemic kind of converge upon each other, we do see increased suicidal ideation. We do see increased substance misuse. We do see economic factors impacting people's ability to have nutrient dense foods. And we've had children come to the unit that didn't have winter coats, so we have other funding streams for supplies and medications and fuel. And I think this funding would be used to give some depth to our interdisciplinary treatment team so that we can have nurse practitioners on board. We talked about translators earlier and the importance of that. I mean, we've really run into that, serving individuals from diverse backgrounds. So
thank you.
Yes.
Ian?
Thank you. Good to see you all.
Thank you.
My question really is, I believe Delaware County is using some of their Fund 10 health, their brain health, that Fund 10 balance. It, with you, I think there's a contract, maybe under negotiation. Have you done any of that work? I mean, how do you see that? I still have hope that this will be a mechanism for brain health.
Yes. Yes, so we have a $55,000 contract in progress with the Delaware County Board of Supervisors. And so as an example, today I worked up at Mercy One Elkader, not with the mobile unit, just working there myself. And, you know, so I go by Rickardsville and Holy Cross and I tool along and I get to Luxembourg and I'm going to cut over Delkader. 8 more miles is Colesburg, so Delaware County. So, and that too is a high priority zip code for poverty. So, so we in the past have been able to use funding from different streams to support different populations or different counties with good result. So those funds will expire at the end of this fiscal year. So our window to do that work for Delaware County is going to be a small one, but we will find a way to continue for needs that they may have as well. I think last time I presented Supervisor Wickham, I talked about Clinton. So Mercy One has a market in Clinton. So we've been to Clinton 3 times with the mobile unit, using funds from that neck of the woods to support 70 homeless in that community that are currently sheltered at a hotel because they don't have shelters, good shelters and services like we have in our community here. So, so a sprinkling to Clinton, some very focused intentional brain health work for Delaware County, with the majority of the work that this unit will provide in Dubuque County. And keeping all that straight.
Yeah.
Thank you for asking.
Anything else, Ann?
No,
Aware you didn't receive any Fund 10 balance from Dubuque County here.
You had a lot of requests in front of you, you know, in that regard. So
There's a lot
understandable.
of requests for the ARP funds too.
Yeah.
But we'll work through that. I don't have any questions.
can I ask one more, Chair Pata?
Go ahead.
There's a concern about the duplication of services of other mobile units. Is there a status update on whether you'll be the only mobile unit activated in the community?
A great question. So just yesterday, day before, Crescent Community Health Center reached out again. We have had some communication with them and they have received a school-based grant. And again, it's kind of getting right into that school and providing well child visits, immunizations, other needs children may have. And so we will be meeting to talk about joining forces to do that good work as well. Might not be necessary to have 2 mobile medical units yet, although you know, their vision involves some dentistry and some other pieces. So, but I think having those conversations, leveraging our resources, whether it's nurse practitioners or mental health therapists or what, you know, community health workers, translators, working together to achieve what is our goal as a community, as a healthcare community, as a brain health community, I think will serve us well moving forward.
I really appreciate that you're having the conversation with them, and I know you've had several. So to make sure that we're not taking on this kind of resource as a community just because there might be other options, but trying to join forces and work collaboratively.
Yes.
Thank you.
Thank you, Melissa.
No.
Thank you, Sue.
Thank you for your time.
Appreciate it.
Yep.
Thank you very much.
I'll make a motion to recess for 2 minutes.
I'll second. Have a motion and a second to recess till 5:30. All in favor signify by aye.
Aye.
Aye. We are in recess till 5:30. Ready? It's 5:30. We'll call the Board of Supervisors into session for the Monday, February 28th Board of Supervisors meeting. We'll start with public comments. At this time, anyone may address the board on matters of which are on the agenda. Please go to the podium, state your name and home address. Individuals wishing to comment on a public hearing will be given the opportunity during that respective hearing. Individual remarks are limited to 3 minutes. Do we have anyone in chambers that wishes to address the board? Do we have anyone online?
We do not.
Okay. Moving ahead, we'll go to proclamations. We have Irish American Heritage Month. Whereas the Irish heritage of Dubuque area is an integral part of the community's character and identity. And whereas a celebration of St. Patrick's Day will be held by the Ancient Order of Hibernians, Dubuque County Division Number 2, refounded in 2013, Ancient Order of Hibernians, Dubuque County Division Number 1, and the Lady AOH Dubuque County Division Number 1, founded in 2017. And whereas Irish Americans have made an indelible mark on the history of Dubuque, the United States, and the world. And Irish Americans are proud of their deep cultural, historical, and familiar ties that have contributed to the strength of our vibrant relationship with Ireland for more than 100 years. And now, therefore, the County of Dubuque Supervisors, on behalf of the staff and citizens of Dubuque County, Iowa, do hereby proclaim the month of March 2022 as Irish American Heritage Month in the County of Dubuque, Iowa, and call upon our citizens to recognize the efforts of the Ancient Order of Hibernians, Dubuque County Divisions Number 1, Dyersville, and Number 2, Dubuque, and the Lady Ancient Order of Hibernians, Dubuque County Division Number 1. Proclamation adopted this 28th day of February, 2022.
I'll make a motion to approve the proclamation.
On behalf of my great grandfather, John Mulhall, who came from Ireland to Dubuque County, I will second that.
We have a motion and a second to approve the proclamation. All in favor signify by aye.
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 Aye. To you to sign, Jay.
So does Hot Off have any Irish? Or just
Nobody
on the
like March
17th?
17th.
You like March 17th? I had to put my claim in because it's not obvious, as some of the supervisors.
No, I have no Irish. So move on to the approval of the minutes. There were corrections made to the minutes. Mary notified us.
Did we have anyone that wanted to speak related to the proclamation?
Oh, I'm
or take a
sorry.
Picture or anything?
Do you want to speak, Pat? Sorry about that. Sorry, Jay.
Good evening. My name is Patrick Leonard. I am the president of Dubuque County Division 2. And on behalf of our almost 200 members between the Dyersville Division, Dubuque, and the ladies, we thank you for the proclamation. Bring to your attention the parade in Dyersville, which is the 12th, starting around 1 o'clock, 1:30. And please come out and pray for good weather, for the luck of the Irish. And always also to remind everybody of the Irish Hoolie that we put on here in Dubuque every year. That's an AOH event also. And that is August 27th. So we thank you for the proclamation and appreciate all your efforts.
Thank you, Pat.
Pat.
Thank you. Should we get a picture? Let's get a
Could
picture.
get a picture.
Come on up here. We'll get a picture. You've got your great green coat on there. I know, that last name too.
There you go.
Hope for great weather.
You bet.
Yeah, we'll keep that. We got one more. Yep,
There you
we'll
go.
get you the official one.
All right, we'll move forward to the approval of the minutes of February 18th, 2022 budget meeting and February 22nd, 2022 board meeting.
I
I'll
will
make a motion to approve both sets of minutes as amended.
I will second that.
Have a motion and a second to approve the minutes as amended. All in favor signify by aye.
Aye.
Aye. Next, we go to consent items. There are no consent items for approval at this meeting. We'll go to procurement procedures. Receipt of bids for the HMA paving culverts revetment and shoulder widening on Old Massey Road project LOST 23 parentheses 1-73-31.
Fantastic. This is Auditor Dragato. We have two bids for this project. The first bid is from River City Paving, and it does include a bid bond. Bear with me here.
Very few live shows on TV.
High degree of difficulty to open up an envelope this evening.
She had Band-Aids.
Oh.
ready.
You're just making us miss Mary more, right?
The total amount for the bid from River City Paving is $1,122,246.91. That is $1,122,246.91. The second bid for this project is from Top Grade Excavating. Their bid bond is also included. And the bid is $1,159,602.33. Again, that is $1,159,602.33.
Thank you, Kevin.
That's the two bids.
Those are the two.
Let's make a motion to receive the bids and refer those to the county engineer for his further review and recommendation.
Second.
Have a motion and a second to forward the bids to the county engineer for his recommendations. All in favor signify by aye.
Aye.
Aye. Carries. Next, we have receipt of bids for HMA resurfacing and pipe culverts on Rockville Road, Old Worthington Road, and Old Farley Road, project LFM-P23 parentheses 03-7X-31.
All right, good evening again. And we have one bid this evening from River City Paving, and their bid bond is attached. And the bid amount is $3,186,838.48. Again, that's $3,186,838.48.
And that is the only bid, Kevin?
That is the only bid.
Make a motion to receive the bid and send it to the county engineer for review.
And I will second that.
Have a motion and a second to forward the bid to the county engineer for his review. All in favor signify by aye.
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 Aye. Carried. Next, we have notice to bidders, HMA resurfacing, culvert replacements and grading on Habercorn Road, project LFM-P23 parentheses 4-7X-31. What's the date of that?
March 28th.
March 28th, was it?
Yes, they'll be opened on March 28th. They're due 3 p.m. Friday, March 25th.
Okay.
I'll make a motion to approve that notice to bidders.
Second.
Have a motion and a second to approve the notice to bidders. All in favor signify by aye.
Aye.
Aye. Next, we have notice to bidders, bridge replacement on Hickory Valley Road, project LFM-B23 parentheses 2-7X-31. That's the same time. Auditor Dragato.
Yes, that's correct.
Make a motion to approve the notice to bidders.
And I will second that.
Have a motion and a second to approve the notice to bidders for the bridge replacement on Hickory Valley. All in favor signify by aye.
Aye.
Aye. Next, we have a notice to bidders. Bridge replacement on North Bankston Road, project L-B 23 parentheses 3-73-31.
Believe that is also due on March 25th. I'll make a motion to approve the notice to bidders.
Second.
Have a motion and a second. Motion and a second for the notice to bidders for the bridge replacement on North Bankston Road. All in favor signify by aye.
Aye.
Aye. Carry. Next, we'll move to public hearings. Notice of public hearing for amendments to the zoning ordinance.
Looks like the date's March 14th. I'll make a motion to approve the notice of public hearing.
And I will second that.
Have a motion and a second to approve the public hearing for the amendments to the zoning ordinance. All in favor signify by aye.
Aye.
Aye. Carries. Approval of plats. There are no approvals, no plats for approval at this meeting. We have action items. The board may approve, deny, or table any action item. First, we have a resolution to approve the Dubuque County Training and Travel Reimbursement Administrative Policy. Dawn, did you want to give context to that?
Yeah, Auditor Dragato and I and members of his staff reviewed this policy. His department is the lead in compliance with this. But the main addition to this is effective on January 1st of this year. New Iowa law went into effect in which counties cannot expend county funds at any facility that is not certified by the state, making sure that all of their employees are attending the human trafficking training as provided by them. And so this just indicates to employees that they will need to verify. There is a website to verify the facility. This is for overnight stays, conferences, even luncheons as well. They'll need to verify that in order for the county to reimburse them or to pay for the travel or conference.
Yeah, that sounds pretty reasonable. Looking for a motion to approve.
So moved.
I will second that.
Have a motion and a second to approve the resolution for Dubuque County Training and Travel Reimbursement Administrative Policy. All in favor signify by aye.
Aye.
Aye. Next, we have a resolution to approve the fiscal year 23 Burn JAG grant application.
That seems higher than previous years, just by my memory, but
I thought the same thing, Jay, when I was looking at it.
154. That's good because we're
70
receiving it.
75% reimbursement, I believe, on it.
I would make a motion to approve the resolution as presented.
Second.
Have a motion and a second to approve the fiscal year 23 Burn JAG grant application. All in favor signify by aye.
Aye.
Aye. Carries. Next, we have a duplicate warrant for Tom O'Neill.
Make a motion to approve the duplicate warrant.
I will second that.
Have a motion and a second to approve the duplicate warrant for Tom O'Neill. All in favor signify by aye.
Aye.
Aye. Next, we have a resolution to approve the negotiating a professional service agreement with Origin Design for the Northwest Arterial John Deere Road Corridor Project. You have Anthony on, I don't believe so.
Good evening, I am on here.
Oh, okay, sorry, Anthony. You want to-
Okay. Yeah, so I'll just give a little background on this. So we had a consultant selection committee. We met on February 8th, 2022 to interview and evaluate the two consultants that put in an RFP for consideration. We had Origin Design and we had Bolton and Mink submit an RFP for their qualifications to act as the construction consultant, consulting engineering department for the John Deere Road project, and also, if needed, also on the Northwest Arterial. So after doing the scoring process, we ultimately scored Origin Design as the highest, I guess, the highest score, and we are recommending that we start the negotiation process with Origin Design.
Any questions for Anthony?
Anthony, do you have a estimated dollar amount for this contract?
I think initially what we estimated in our SDBG, so our SDBG grant that we got for the preliminary engineering and construction engineering, the construction engineering part, I think we estimated around $450,000. So that's just, just kind of a rough estimated figure. So we'll have to, kind of see where we're at once we negotiate with Origin Design.
Okay, thank you.
Ian, do you have anything?
No, I was part of the scoring committee. I'll make a motion to approve the resolution.
And I will second that.
Have a motion and a second to approve the negotiating a professional service agreement with Origin Design. All in favor signify by aye.
Aye.
Aye. Carries. Next, we have a resolution to approve the plans and specifications for the HMA resurfacing, culvert replacements and grading on Habercorn Road, project LFM-P23 (4-7X-31).
Okay, good evening again. So this is the HMA resurfacing project, which also includes some culvert replacement and minor slope grading. This is a project from Sherrill Road or Balltown Road down to down to Sherrill Road down there. Let me read the description here. So located on Habercorn Road and South Mountain Road from Sherrill Road to Balltown Road. So it's a total mileage of about 4.7 miles, and good project to get going. So I recommend the approval of this.
Thank you, Anthony.
I'll make a motion to approve the resolution for the Habercorn project.
Second.
Have a motion and a second to approve the plans and specifications for the Habercorn Road project. All in favor signify by aye.
Aye.
Aye. Carries. Next, we have a resolution to approve the plans and specifications for the bridge replacement on Hickory Valley Road, project LFM-B23 (2-7X-31). Anthony.
Okay, this will be on Hickory Valley Road, as you just mentioned. This would be for the replacement of, I believe it's a 10-ton load embargoed bridge. We'll be replacing it with a 100-foot by 30-foot concrete slab bridge, and I would recommend this.
Make a motion to approve the resolution.
I will second that.
Have a motion and a second to approve the plans and specifications for the bridge replacement on Hickory Valley Road. All in favor signify by aye.
Aye.
Aye. Carries. Next, we have a resolution to approve the plans and specifications for the bridge replacement on North Bankston Road, project L-B23 (3-73-31). Anthony.
This will be another load rated bridge at, I think, 23-ton embargo. This will be for the replacement with a 50-foot by 30-foot concrete slab bridge. It's one of the older bridges out there. I think this is a 1913 bridge, I believe. So it's got some age on it. So definitely recommend going with the replacement on this.
Strike while the iron's hot. I will make a motion to approve the resolution for the bridge replacement on North Bankston Road.
I'll make a second.
Have a motion and a second to approve the plans and specifications for the bridge replacement on North Bankston Road. All in favor signify by aye.
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 Aye. Carries. Next, we have a resolution to approve the Mercy One Turning Point purchase of service agreement. Stella, did you have context on that?
was gonna say, Ed put this together, but this is for the purchase of service agreement that the board decided to fund for the Turning Point at $60,000.
This is the medication assistance program.
Yes.
I'll make a motion to approve.
And I will second that.
Have a motion and a second to approve the purchase of service agreement with Mercy One Turning Point. All in favor signify by aye.
Aye.
Aye. Next, we have communications, correspondence that the board will receive and file without taking action. First, we have the amended and restated urban plan for Greater Downtown Urban Renewal District.
I will make a motion to receive and file the plan.
Second.
Have a motion and a second to receive and file the updated plan. All in favor signify by aye.
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 Aye. Next, we have a manure management plan from AAA Pork number 69269.
Make a motion to receive and file, noting that there's no changes.
And I will second that.
Have a motion and a second to receive and file. All in favor signify by aye.
Aye.
Aye. Next, we have more manure management plan from Steve Holger, Hog Site Home Farm number 69221.
I'll make a motion to receive and file.
Second.
Have a motion and a second to receive and file the manure management plan from Steve Holger, Hog Site Home Farm. All in favor signify by aye.
Aye.
Aye. Next, we have appointments, open vacancies for information only. Any questions on any of that from my colleagues? And we'll move to Whitewater Township trustee. We have an appointment or an application for appointment from John Lynch.
Make a motion to approve the appointment of John Lynch as a trustee for Whitewater Township.
And I will second that.
Have a motion and a second to appoint John Lynch as a Whitewater Township trustee. All in favor signify by aye.
Aye.
Aye. Personnel requisitions. There are no personnel requisitions for approval at this meeting. We'll move into the public comment section. At this time, anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please go to the podium, state your name and home address. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Do we have anyone in chambers? We do not. Do we have anyone online?
We do not.
That will conclude our meeting.
Make a motion to adjourn. No, wait, we're gonna meet to canvass this week, are we not? Kevin, do you want an adjournment?
Yes, I still want an adjournment. That'll be a separate meeting.
That is Thursday at 1 o'clock, correct, Kevin?
That's correct. We'll see you here for about 3.5 minutes.
Motion to adjourn.
And second.
Have a motion and a second to adjourn. All in favor signify by aye.
Aye.
Aye. We are adjourned.
Thank you, everyone.
Thank you, Ann. Thank you.